Hello, everyone. Welcome back to another episode of Testimony Thursdays. I'm your host, Dr. Jazz. I have another special guest with me today, y'all. I cannot wait to talk about this episode. I have 1,000 questions per usual, but we're going to do what we do first and get started with our Bible scripture. This reminds me of our next guest. This is from Ecclesiastes 9:7. So go ahead, eat your food with joy and drink your wine with a happy heart. For God approves of this, y'all. That's biblical. That's biblical. So when y'all see me eating and drinking my wine, mind y'all business, because that's what the Bible says to do. Okay. All right. So I have with me today Lolo. I met Lolo actually through my best friend, Charity, y'all. And I've known Lolo for a couple years now. I follow her on Instagram, and I was a guest on her podcast. I can't wait to talk about that. But yes, Lolo, thank you for being here. Before you introduce yourself and get all of that started, I do no, actually, I'm gonna have you introduce yourself first before we do the icebreaker.
So my name is Lolo. I don't think anyone calls me by my government name, so I won't say my government name, but I'm Lolo. Um, I am a mental health therapist and now oncology social worker in the medical field now. I love to helping people. I love to talk, but in certain situations, I'm introverted, so it's could be both. But I'm happy to be on the podcast today. So thank you for having me today.
Yes, thank you, Lolo. I think do you have your AirPods in?
I do. Can you hear me? Is it a little bit muffled?
Oh, it's better now. It was
Okay, cool, cool.
um,
Okay, good.
did you say you're an oncologist, social worker?
Oncology social worker now. Yes, so with cancer patients.
Wow. Oh my gosh, I have 1,000 questions. Okay, okay.
Okay, cool, cool, cool.
Oh my gosh. Oh man, you are wonderful. Okay, so what Lolo didn't mention, y'all, is that she loves to eat and have fun.
Yes, that's what the scripture kind of correlate with that. I love that. So yes, I
Yeah.
do have a food blog. I forgot to mention that. Yes.
And I love to watch it, y'all, because y'all know I'm from South Carolina. So I love like seeing her post different things from South Carolina. So the icebreaker today is gonna be this or that. So you gotta choose
Okay.
which restaurant you would want to eat at. And I think I already know some of the answers. First one, Waffle House or Denny's?
I don't think I've only been to Denny's when I was a kid. So I would say Waffle House. The All-Star Special is still my favorite. So
All Star, like that's a no brainer. I feel like anybody
yeah,
Denny's, like, no, you never been to Waffle House, clearly, if you choose Denny's.
yeah.
Texas Roadhouse or Cheesecake Factory?
I've never been to Cheesecake Factory yet, which is probably shocking. And I don't like Texas Roadhouse, so I would say neither.
You don't like the bread and the cinnamon butter from Oh gosh. Okay, well, we definitely got to get you Cheesecake Factory then.
Yeah. I like Logan's Roadhouse better, but I may be biased because that's my real name, so maybe that's why.
I don't think I've been there before.
It's the same thing as Texas Roadhouse.
Oh, okay. Um, geez, I'm blanking. What is that restaurant? The Pig restaurant in South Carolina. The Pig. I can't even.
Heard of the pig.
It's on. Shoot, I can't even remember what it is, but that's okay. Um, Chili's or Applebee's?
Oh, that's a tough one. I grew up on Applebee's, but adult me loves Chili's, the triple
Okay,
dipper.
yeah,
So yeah,
I think I'm gonna have to go with Chili's. I just feel like I don't know
yeah,
why. I feel like they're more upscale, but it's really the same thing.
yeah, yeah.
Kiki's Chicken and Waffles, or think of another one I can compare that to. Kiki's Chicken and Waffles, or you know what? I'm gonna say Chick-fil-A.
Mm, I feel like as far as distance, because we don't have Kiki's here, I'm gonna go with Chick-fil-A because it's more accessible to me.
Yeah,
So that's the only reason why I pick it.
yeah. I kind of low key would go with Chick-fil-A anyway. I like with Kiki's. I do like the veggie platter. That's one of my favorite things from Kiki's Chicken and Waffles. But Lola, where are you located right now? Florence?
So I'm still in Florence. I've been here for almost 2 years now. So I actually moved here and I actually prayed to God. I was like, God, I don't know how you're going to work it out, but I moved in November of last year and I got my job offer that same month. So he worked it out. I put it in his hands and he worked it out.
Listen, that's a testimony right there. Oh my goodness. So what? I
hmm
have 1,000 questions. So are you doing like your mental health therapy at the same job with the oncology job? or is that separate?
So full time, I'm a oncology social worker, and part time, I'm a medical mental health therapist. So I do it part time. I've always done it part time, but yeah, I like the balance. I like the balance of doing it both.
And I think too, you were working in pediatrics. Were you working with kids before?
Yeah, with kids. So I did like substance abuse with teenagers. But
Yeah.
ironically, now one of my specialties is teen depression as a mental health therapist. So I still am able to work with teenagers. So yeah, it worked out.
Cool. So with oh my gosh, I mean, I just have a thousand things to ask. With
Yeah.
you know, how does that? Do you go to people's homes, or are you working at a hospital? Like, what is your day?
Yeah. So I'm in a hospital setting. I'm the first social worker that they've ever had. For the specialty at the hospital. So it was a lot adjustment for them to see what I can do, right? You have to like show what you can do. But I'm a part of the EOM program. So it's the enhancing oncology model. So for me, it's social work. So housing, food assistance, bill assistance, shelter, prescription, copay assistance. And then with the EOM attachment to it, I do quality assurance. So I do like it's a lot. So I do reports. You have to do math. I'm like, I'm a social worker. I'm doing math, but it's a lot in one role. But I enjoy helping people. And I never knew. I mean, I knew about cancer, but it's different seeing people battle cancer and then having financial hardships or food insecurities, or some people have mental health issues. So I don't think one day is the same. I can help 5 people one day and it could be 10 people one day. So it varies, but I enjoy it. I enjoy it a lot.
Yeah, and I always say like social workers definitely make the world go round because
Mhm.
like even for me, like I do home health physical therapy for my full-time job. And I see a lot of like food insecurity,
Mhm.
just people struggling in general. And they're like, what resources are available for me? And I'm always referring to our social worker, and she'll come to their home and she'll like
Good.
talk about like how they can get on Medicaid or apply to Medicaid, and then like Meals on Wheels, talking about different
Mhm.
things like that. So yeah, for me, I'm like, I feel like everybody just needs to talk to a social worker and figure out what is the best thing for them to do. And I actually had an episode a couple weeks ago with a young lady who has a organization called the Baylor Project, and it's where she
Oh,
educates different families about pancreatic cancer from her dad's testimony. And I wonder if she knows about like social workers, medical social workers that can work in oncology and just kind of get people set up. Or do you refer to like different support groups or like nonprofits for your?
yeah. Yeah,
Okay.
so I have one good organization. It's called Emerald Angels, and they help caregivers and cancer patients with having support. So caregiver support, but I tell people I'm the refer out queen. If I don't have a resource, I said this in my interview. I'm like, I'm on Lydia. I'm going to Google it. I'm gonna find it or reach out to other social workers. So yes, I refer patients a lot to different resources, whether it be support, food resources, but I just try to help them understand that we want to focus on you getting better and stop these barriers for care. So that's kind of how my role is. So yeah.
Oh, yeah. And I'm the same way. And I even because I do a lot of like public speaking with students, and I tell them like, listen, in the real world, you can use Google, you can use
Hmm.
Chat GPT, whatever it is. You can use those things if you don't know the answer. Like, yes, you need to have like critical thinking skills, but to me, my critical thinking skills is like how you said, okay, I know you need the help. I don't have the help right now that you need. I don't
Hmm.
have somebody right now that I can refer you to, but let me do a quick Google search. Let me get on TikTok. Let me get on Instagram. Let me use this hashtag and
Hmm.
find a community for you to help you. Like to me, hearing no is not the answer, like ever. Like I feel like I just don't have it right now. I don't know, but
Hmm.
I'll get back with you. And
Exactly.
yeah. And as millennials and as like Black women, I feel like we just take on that role with us. We're like, no, like we need to figure this out. And even for me, like I treat everyone as if they were my family. And I'm like, well, okay, this is my mom. What would I want somebody to do for my mom? Or like, like my sister, my nephew, my dad, like anybody, how would I want them to be treated? So I think that's really important. And I do have some questions too about mental health and like just like being a mental health therapist, and oh my gosh, I don't even know what question I want to start with first. I guess what are some of the signs of concern that we should be looking out for like our teens or our family members that they may be struggling mentally?
And I would say a big one is isolation, right? In our community, it's like, oh, my homegirl, they acting funny. I ain't talking to her, but notice the signs when someone who's usually, open with you and they start to isolate themselves or text you back later or just don't text at all. I feel like that's one sign of depression. Like I said, in the Black community, it's such like a taboo thing. Well, I want to ask, but I'm scared to ask. But I would say know the signs of someone. If someone's behavior is different, something's probably going on, right? So that's my, not advice, but an observance that you should take when it comes to someone you're close to.
And I think too, the scary part is that we might ask that question and then we find something is going on and
Mhm.
we don't know how to help. So that will be my next question is like when we see those red flags in like our teens or something and they stop responding or they're, acting funny or something. And we do realize that they're going through a rough patch in their life. How do we help them? How do we say, like, hey, I think you need to talk to a therapist, or you may need to go to your doctor to get medication? Like, how do we even have that conversation?
And honestly, Jazz, it's as simple as that. It's as simple as that. I'm seeing these patterns in you. Like, you think you need to talk to a therapist. I have some people like, girl, look, I'm not talking to a therapist. And I had a friend a week later say, girl, I went to therapy. I needed it. I was like, yeah, I told you. Come on. So it's like having just an open conversation. It's no pressure because they're your friend, your cousin, your sister, your brother, your uncle, your aunt, whoever. You love them. So you should already be feel comfortable having that conversation. It's simple as that. Have you thought about going to therapy or you having a crisis? Have you ever heard the crisis hotline? So it's as simple as that. I feel.
And then another follow up question with that: if you do those things and you provide them with those resources, and then they don't follow up, and they keep like spiraling, and it's like you could obviously see that they need help, but they might not see that they need help, and they think they're fine. Then it's like, okay, what do you do then if they don't want to comply?
Yeah, and if it's in a part where they're a danger to themselves and others, you have to do the wellness checks, the welfare checks, 911. Some people have to be involuntary committed, but if it gets to that point, that's what it has to be because you want your loved one to be okay. So it's a scary thing, but you have to think about their safety. So that would be the next step for sure.
100%. And like, even for me, being a physical therapist, I am a mandated reporter. And this past week has just been wild. Like, oh my goodness, like APS was involved, welfare
Mm,
checks, 911 was involved. And I had this client that he was just saying things that made me have to, report to the police. And
yeah.
it's one of those things where it's like, I don't know if you're joking, I don't know if you're serious, and you have weapons in the home. And I go to the home
Mhm.
and it's like, I didn't feel comfortable with asking, like, oh, are you joking? Are you serious? Like, it's just, you said what you said, and now I have to report that. And I'm not going to tell you I'm going to report it. Like, the first thing,
Yeah.
so I'm going to go out and, leave the home, make sure I'm good. And then I'm going to call the police. But even when I did that, it's like he's upset and he ended up calling like my job. And my managers already knew because I called them like as soon as I left.
Yeah, I reported it. Yeah.
Yeah. And then like he actually didn't answer the door for the police and stuff. And like the police ended up calling me back and told me the whole thing. But that's another thing too, where it's like, how do you deal with doing that? And then somebody's mad at you for doing that, especially if it's your family. Like if, with this person, like hopefully I never have to see them again. But when I
Yeah.
live on an island and it's this big, so maybe
Yeah.
I don't know. But if it's my family, like how do I get go through like somebody being mad at me for helping them?
Yeah, and that puts you in a tough space because you want the best for them. But I always tell people when you've done the best you can do, that's all you could have done. It's up to them to want to get the help. Voluntary versus involuntary is two different things, but ultimately it's up to them if they want to get help. If you know in your heart you did all you could do, you did good enough. That's how I feel about it. When it comes to family, you did enough.
Yeah, that's good. And it's yeah, it's tough. It's tough to have to be that one that's like, hey, I'm gonna call, whether they get mad at me or not, but I know that I'm doing this for the right reason. And people who are having like mental health or like battling with those issues, they might not be able to see it now or ever. You might
Yeah.
never get like an apology, or you might, it might be like an ongoing thing. But I think it's important to, keep that communication open and just being able to like keep being there for them, but also being there for yourself too, and not taking on that pressure of like, I need to fix them. I need to do this. I need to do that. Like, no,
Mhm.
you can, example of this is, I'm a big Beyonce fan. And Mama Tina, she just released her book, The Matriarch. And it's a really good book. I'm listening to the audio version. But she's been doing like a lot of press and interviews and stuff like that. And she talked about, and I've been through this because I'm a big Beyonce fan, but she talked about like how she put Beyonce in Solange in therapy when she noticed that Beyonce was about to be like a big star, like at a young age. And at that time it was like taboo. It's like, why are you putting your children in therapy? Like that's gonna make it worse and all of this and that. But then like, at that time you couldn't see why, but years now you can see that they have like a healthy relationship. Even though, we don't know them personally, but they have the tools to have that relationship if they wanted it. But yeah, I think that's important. And what else can you talk about your podcast and how that's helping serve the community as well?
Yes, I took a break from the podcast. I feel like I have, you know how somebody, you remember Everybody Hates Chris and the lady was like, my husband got 2 jobs. I don't need this. So I technically have 3 jobs now, technically. So it's like everything, something gets on the back burner. But I will talk about how I started my podcast. I do have an episode, but I haven't uploaded yet. It's called 30 for 30 because I'm 30 now. But I started my podcast after my dad passed because I just got tired of people saying, "Are you okay?" Or, "Is there anything you need?" So I was like, I need my own outlet. And one of my friends actually pointed out how the podcast, it wasn't dark at first, but you can tell that I was like coming out of the grief depression. So everything got lighter. I started having guests. So that's why I started the podcast. So if my dad didn't pass, I don't think I would ever start the podcast. But I always wanted to start one. At first, I talked about my experience with depression, anxiety in college and life after college, and it kind of grew to topics and it grew to guests. So it was like, a dark cloud, but the end of the podcast was like a big rainbow or butterfly. Describe it. Yeah, it's called Lolo Chats. I don't know when the last time I uploaded a podcast episode, maybe last year. So if my guests see this, please don't be mad at me. I'm gonna try to. And you were on the podcast too, but I had a segment on my podcast where I did millennials with their experience. So I had you, the millennial doctor. I had a millennial in tech. I had a millennial blogger. I had a person who was trying to become a doctor. So it grew over time. But yeah, that's Lolo's Chats in a nutshell.
Yes, yes. I definitely love Lolo chats. And it definitely serves its purpose of being able to help you like use that as an outlet. And I think too, like a lot of times when we do things, we kind of have pressure on it. Like even with me, I'm like, oh my gosh, like I said I was gonna do testimony Thursdays. I need to drop an episode every Thursday. But it's like,
Mhm.
relax. Like as long as you're hitting the purpose of what you're supposed to be doing, like it doesn't have to be perfect all the time. And like I'm a new podcaster. Like this is something I'm still trying to figure out myself as well. So I think, yeah, just continuing to be on that road of purpose and then realize that sometimes, we got to make a U-turn or we have to pivot or any of those things. So that's important. And then, yes, Lolo, I'm not going to take too much of your time. And how we end every episode is basically talking about a test that we went through that led to a testimony. And I feel like
Mm.
talk so much about that on the episode, or a test that we're currently going through that's going to lead to a testimony. So if you wanted to speak on that.
Yeah, so I'm currently trying to get my license for South Carolina. I took it in 2022, I think. And it was kind of in the between when my dad passed. So I really wasn't prepared for it. But I took it in this month and I failed it by 2 points. And so I got the thing on the screen and it said fail. And I was just like so defeated. I was like, this can't be real. And then I regrouped and I prayed and I said, you know what, God, everyone has a different journey. And this is just a part of my journey. When I saw the report the next day and it said 96 out of 98, I was just like, really? Like, what? Like, this can't be, what's happening. But I regrouped and I told, and like I said, I prayed and I said, you know what? Everyone has their own journey. I've known people that have to take the test 6 times, 10 times to pass it. And this is just a part of my testimony, my journey. So I'm going to regroup. I'm going to take it again in June, study over my weak points, and then I'll walk out, a licensed master level social work of South Carolina. I did it for North Carolina. I'm still in training, so I can do it. But I always tell people it's on God's timing. So it's not on my timing. So that's a testimony in the making.
Oh my goodness. Thank you for sharing that. And I definitely feel that. Same with me. Like I wrote a
Mhm.
book, my GPA was
Yep.
2.76. I needed a
Mhm.
2.80 to
Mhm.
remain in the program. And it's like that is so close. And it's just you do get to that point of like, okay, I feel defeated. Like, why is this happening? But you're right, it's on God's timing. And it's something you can use to share and inspire others. So with our testimony. So Lolo, tell the people where they can find you to support you.
I am on Instagram, Eats Lolo. So that's for my food blog. I am Lolo Chats on Instagram, and that's where you can find me on my social networks. I will be posting on Lolo. I'm on Eats Lolo or Lolo Eats. We'll be going to Atlanta in about 2 weeks. So I have a collab with two restaurants. So be on the lookout. They're Black-owned businesses. So I'm happy to collab with them. Still working on some more, but if not, that's completely fine. But yes, I will be posting. And I'm on TikTok. I think it's Lolo Eats 4 or 34 is four maybe, but I don't have that many followers, but I post on TikTok as well. So yeah.
Oh, I'm hungry. I'm hungry. I'm hungry. I'm hungry. Okay, no, I do have one more question. But with first of all, Atlanta, one of the best places I love to eat in Atlanta is Twisted Soul Cookhouse and Pours.
Mhm.
So I hope you get to check that out. And then the Hive. I do love the Hive.
I went there last time. That food was so good.
Yep.
The food was good. The vibes was there. It was really, really good. My friend was like, "This is a hood spot." I'm like, "Just chill. I'm with you. You good. You good. Don't just
Yeah.
be okay. Be okay. Be okay." But I loved
I
it. Hmm?
feel like it's that hood. Is it that hood?
Is it the one in Buckhead?
Yeah.
Yeah, we're
Um,
from the same place, but he's more of an introverted person. So I'm
okay.
too, but I like the food. But I go to Atlanta once a year now. So I'm going to see Jacquees and Dage Loaf in concert. So that's why I'm going. Um, but it's my annual trip. So I love to go down there and support Black owned businesses when I go down there. Stay at a nice hotel. I think I'll be staying I stayed at the hotel. Can't remember what the name of it, but that's when they have like the floating restaurant. I don't know what it's called. I stayed there last time, but I don't know what it's called. But they have really good food. So I like to, treat myself.
Yeah.
So we'll see. We'll see. We'll
Period.
see.
That's gonna be nice. Okay, last question. Sorry. What
Oh,
in the United States, what are the three top I'm gonna say cities, the three top cities for the best food in your opinion?
Atlanta.
Yeah, period.
Or I don't know. I'm biased, but I think South Carolina has some really good eats. I really do feel like they have like hidden gems.
Mhm.
I'm trying to think of a third one. I've been to Dallas once. Their food was pretty good, but I'm going to Houston this year, so I want to compare the
Yeah,
food from Dallas to Houston because I know that Houston is more southern. Beyonce was born there. A lot of different good recommendations. So I would say so far Dallas, Atlanta, and Atlanta.
yeah. I would say the same. I would say definitely Atlanta. Definitely, I would say Charleston. I feel like
Oh
has,
yes, absolutely, yeah, absolutely.
and then I would say I'm just gonna loop. I'm gonna loop Dallas and Houston together because yeah, and
Same
then
here.
I don't know because I feel like New Orleans like it has to
I've
be.
been yet. I need to
Oh,
go.
you gotta
I'm supposed
go.
to go in June, but I don't think that's going to happen because my friend has some stuff come up. But
Mm,
that's my next stop. Just take a week off work just to sit there and just eat for a
eat.
whole week.
Yeah,
That's
I
it.
don't have
Don't
to do.
even look cutesy. Just eat.
I don't have to do
Just
anything
eat.
else. Eat. That's
Just
it.
eat.
Yeah. Let me bring
That's
my
it.
joggers because I'm not. Yeah.
Just eat.
Thank you so much, Lolo. I appreciate you for joining on this episode and just speaking your truth and your testimony, and also giving us some really good tips on how we can help those who may be struggling with mental health issues. So thank you all for joining for another episode of Testimony Thursdays. Follow us on Instagram, TikTok, Testimony Thursdays, and YouTube. Like, comment, and subscribe. And we will see you all next week.